So what I want to do is just kind of let you tell your story for those people who are going to look in and say, okay, how do I get to where she is? You need to really know the story that got you to where you are. Okay, so let's start at the beginning and say, tell us something about your background, your growing up experiences.
Okay, so as I stated before, I'm originally from St. Louis, Missouri. Um, and so yeah, I was born in St. Louis, and I actually am adopted. So I have to say that because that's really been kind of like one of the driving forces that pushed me to a career in psychology, because all throughout my adolescence and all while growing up, I was attempting to kind of understand my experience as someone who, I mean, like I said, I was adopted. So I had an adopted mom, an adopted family, but not always feeling as though I kind of fit into that dynamic, and not really understanding why. Like, I understood that they loved me and that they were supportive of me, but there was always this kind of nagging feeling like, oh, you don't really fit into this equation that well. And it was because, I was adopted, and I had, these other roots and things that I hadn't explored. So
When did you find out you were adopted?
I knew probably about 7 years old.
Okay, so pretty early on.
Yeah, pretty early on. And I found out because it was said to someone else. So it wasn't directly told to me, but I found out by happenstance. But I mean, I kind of, like I said, there was always kind of this like weird kind of feeling that I was like, that I didn't exactly fit into the mold. So when I did find out, it kind of made sense. Like, oh, no wonder, I have or I don't have like some of the family quirks, or I don't look like this person, or I don't do things this way or that way. So it kind of, through that process, I began really wanting to like understand, my experience. And of course, I was introduced to my mom later on. So even with that experience, trying to understand what that was like, trying to understand some of the dissonance that I was feeling, about her and about this whole other family that I really hadn't been exposed to. So pretty much, I knew that I wanted to be a psychologist in high school. But I just had no idea it was going to take this long.
Yeah. Yes.
I really had no idea that it was going to take this long, and the amount of work and personal and professional effort that was going to have to go into it, though. Yeah.
Yes. That's well said. Well said.
I think undergrad was a great experience, kind of venturing out and getting away from home. I tell people it was the best decision I ever made, because it helped to kind of foster some of that independence. And also, I went to a historically Black college and university, and where I come from in St. Louis, I was not used to seeing African Americans doing well professionally. And so when I went to Alcorn State, I got a chance to be exposed to people that looked like me, that were thriving, and that were actually excelling. So that was really a catalyst for me.
Well said.
I think, again, when you're in undergrad, you're learning like the basics of human behavior, the basic psychology. Sometimes some programs might even teach you like micro skills or like basic therapy skills, but not really. So it wasn't until I got to my master's program that I actually got to get a little bit more practice, not a little bit, but a lot more practice when it came to clinical work, and also to the different things that psychologists can do. Again, because I knew kind of where I wanted my career to go, I got a lot of pushback from people saying like, they don't make any money. You should try to be a psychiatrist, try to be an MD or something that's really going to get you somewhere or get you a sustainable income. So I was surprised when I got to the master's program to see like all of the different like avenues and all of the different things that you can do in the field. but and even now as I continue to develop, like I see like psychologists are everywhere in every field, you
Yes.
know.
Yes.
And if you have
Anything that has to do with human beings, that's psychology. Yeah, exactly.
yeah, and I mean, of course, there's going to be a difference, of course, in what you can do versus like what your specialty is, PhD versus master's degree, things of that nature. But one thing that I admire about the field is that I've seen psychologists kind of wiggle their way into many different places, and and fit really well and be able to really educate, and really find their place. So yeah, I think the master's program really narrowed down my focus. Now, because I have a specialization in health psychology. So at Longwood, when I was there, we were doing the disability determination services. So that's something that really sparked my interest. And I didn't know that was a whole separate area within itself. So I enjoyed being able to, talk and interact with people who had various chronic illnesses, whether they be health conditions, whether they be mental health conditions, but kind of really learning more about the mind and body connection.
Right.
I think that experience in itself really, really fueled me for what I'm doing now and really wanting to go into health psychology.
You get that much greater sophistication. Like you said, you get that. That's one of the reasons why I did that with the interns, was it was just such a powerful thing, because you look at that interface of the psychological, the physiological, and the sociocultural, all those things.
Yeah, right.
The folks were coming to see us like, wow, they were teaching you a lot about a lot of stuff because they were struggling. And so it was a real immersion. I love that you got that.
And also too, like, of course, assessment experience, is invaluable. As a mental health professional, as a psychologist, that's always something. If you have that in your back pocket, that's always something that you can use, to generate income. And also, like, if you have, there are a lot of assessments that I've been able to perform and do just because I knew the basics. So because I had practice doing the WISC, the WACE, the MMPI, I was able to administer when it came to going to hospitals and doing different exams for, bariatric surgeries or trauma-informed assessments. I was able to do those things because I had the basic assessment knowledge. So that really goes a long, long way. I will say that.
Wonderful. Wonderful. Good. So talk about, and so when you left here at Longwood, you went to where you're now sort of segueing out of. Talk about your experience at Ball State.
So, Ball State University. I'll say it's been an experience. If you want me to be honest, because PhDs are not for the faint of heart.
No, it is a real testing of your limits. Yeah. It really is not. And I think work ethic has gotten me really, really far, because what I notice is that, I think this is in graduate school in general, even when it came to like coursework, there's a lot of stuff that you were expected to do on your own. You had to take the initiative and have the assertiveness to be able to do things on your own. For instance, like if you were asked, let's say the syllabus says we're going over this chapter during class. So that means when you get in class, you need to be ready to discuss, ready to have a conversation, ready to be able to synthesize what you've read. And so I feel like, had I not had like the accountability that I have and the assertiveness, I probably would not have done so well. But even with doing that, there were still some knowledge gaps. There still are. And I think transitioning out of the program now is kind of like, I'm even more aware of what I don't know. if you get what I mean. So yeah. And what
else do I want to say, Dr.
This is great. I'm loving everything you're saying. It is, it's so good for, not only do I love hearing it from you, but I love for the future folks that watch this, whether it's general public who are just looking at this issue in general, or whether it's the folks who are coming in as our interns. This is good
Yeah.
stuff to know. It's like, like you said, there's that thing about, well, I took a psychology class once, it's like, well, that certainly makes the same as psychologist, doesn't it? It is, like I said, even coming out of a very good program and having done extremely well through a master's and a extensive doctoral program, there's still that sense of, wow, all I know is how much I don't know.
Right.
That's a nice point.
And I think also humbleness is something too that I think people really need if they're considering this, because you can come into a program thinking you're big and bad and you know everything if you want to, and you're gonna get brought down to earth.
Yeah.
And so and something else too that I was surprised about when I did get to my PhD program is the amount of empirical evidence that's behind the work that we do. Yeah. There are some people, again, out there that think that mental health professionals or psychologists are just professional advice givers.
Right.
But there is...
Or for that matter, philosophers.
Yeah. But there...
Not that being a philosopher is a bad thing, but that's really not what
it's different. But there is science behind what we do. And so I think for me, that was something so empowering, really getting to understand the science behind even the micro skills, the basic skills, and the common factors, or the different treatments that we use. Because again, like I said, throughout most of my, life, I've been told that, psychologists are less than, or you're not going to be as important as an MD or this or that. So I think for me, it really instilled a lot of pride in the profession. And even now coming out of it, like I know how hard I worked, and how important the work is. So.
Nicely said. Good job. Excellent. Which is exciting. What's the internship?
So my internship is at Metro Health Medical Center.
Sounds perfect.
So again, because my specialization is in health psychology, I want to do more integrated care stuff. So when it came to internship, there's different places you can apply. You can apply to counseling centers, you can apply to VAs, hospitals. So I know that I wanted to work in an integrated care setting, so I applied only to hospital settings. So here I'll be working in my doc program. Most of my clinical work, again, has been centered around chronic health conditions, but specifically chronic pain. So I spent 2 years at Indiana Polyclinic, which is an interdisciplinary treatment center that works with individuals living with chronic pain. And so that's something that I definitely wanted to continue. So I'll be continuing that at the hospital. There's a chronic pain rotation. But I'll also be in the integrated primary care rotation as well. So basically what that is that, physicians send referrals and recommendations down if they see a patient that might be experiencing some mental health concerns, or even because somatization is a real thing. That is a real thing. So there are a lot of people that go to the hospital or the emergency room with complaints, with physical complaints, but really it's trauma and psychological things that are manifesting in the physical. And so that's where we come in at to try to help patients, work through some of those things, because in the end, it really does save money when it comes to healthcare. So it benefits hospitals and other organizations to have mental health professionals and psychologists.
Very nice. That is just exciting. What do you imagine being beyond the internship in terms of what are you targeting for a career?
So I definitely want to be in an integrated healthcare setting. Again, as far as the specific things that I'm interested in is chronic pain and also chronic illnesses as it specifically relates to Black women. So STDs are a big focus of mine, breast cancer, health conditions that disproportionately impact African-American women.
Nice job. Very nice. I'm just delighted for you. You're doing great. You're doing great. You have become
Well, thank
such a, you always have been very bright, but you have become so articulate and so self-possessed. Way to go. You're doing fantastic.
Oh, well, thank you, Doctor.